Good morning, everyone. I just want to be saying good afternoon or good evening because, I still will never really get used to getting up super early in the morning. Now, when you get older, you get up a lot earlier, and it's just like every person that I've talked to that's got a couple years on them. Now, I'm 49 now, so don't get too crazy, but once you hit that time, things start to happen. And one of them is I just seem to need less sleep. I almost said more because I want more sleep. But anyway, today is BCG Immunotherapy Day. It really is kind of sobering because I just got back from Texas and all this stuff that I've been doing with advocacy, and then it just grounds you. So the day after you do that and have all this awesome stuff happen to you, that's what you have to go through, realizing you have cancer again. And that's one of my big topics. I took my aspirin. If anybody looks back, aspirin, I believe it has an effect. I mentioned it a little bit at this trip I just had, and people are interested in it. I think that it relaxes my prostate. What I'm talking about here is I want them to be able to easily get the catheter tube in so I can effectively get my medicine. I just use a lot of these commonsensical factors, and I just take my precautions, and that's my point, everybody. Be active in your healing. Do the right things. I got the bleach to put in the toilet. I took the aspirin. I've started to relax my abdominal muscles today to just make that area very pliable and just, going at it, straight at it. I got to do it for 3 weeks. I've got 3 sessions. This is my first BCG session of the year, and I have 2 this year, so 2 sets of 3. But here I go. I got about a 15-minute drive, so I'll get this done and I'll film when I come back, and you can see the change in me when I get back, and you'll start to see the allergic reaction. We will see. From what I can tell, the allergic reaction gets a little bit worse over time for people. So it kind of sucks, but I'm curious whether it's going to be worse, because I've had a moderate allergic reaction to this in the past. I do my BCG early in the morning to get it out of the way, and frankly, my doctor has a lot of patience. Doctors are busy. I waited, an hour and a half on my last cystoscopy. That was not fun when you're sitting there waiting on somebody to stick a camera up your penis, very frankly. I am almost there, so I will do this. My appointment's at 8:15 here in about 15 minutes, and I will be back with you and report on what happened, which could be a few things. See you soon. The meds are in, folks. They went in. My prostate wasn't as swollen as I might have originally thought, but it hurt a little more. I feel like my prostate might be a little bit, I don't know, inflamed or something. But the meds went in, and everything went fine and normal. I was way more relaxed this time. I'm really used to this. I don't feel any allergic reaction yet. I do feel a little different. My bladder is a little bit uncomfortable. My urine test came back pristine, they call it, which means, that definition of that word. Which is always a good sign, because I thought maybe I was having a little bit of kidney. I think it's my back, I thought maybe my kidney was hurting a little bit over the last couple of days, but it might have been from the flight and everything. But I am starting to feel a slight, I don't know, so my body is reacting. But I feel a little bit, I don't know, man. I've likened it just to like getting allergies in the spring, which unfortunately it's spring, and I do have a little bit of, something going on in my lungs and stuff, but I felt like it affected like my kidney. I was having like this slight bit of kidney pain, not really bad pain. I was kind of scared about that. My urine test came back fine, so I am wrong about things. I want everybody to realize that. I'm wrong about things sometimes. I'm not on the right trail sometimes. I'm misdirected by bias sometimes. I'm trying to get away from that. I'm trying to make sure that I report things as they happen. I am getting relatively close to home, and I'm gonna go do my turn-in, and I'll do another part of this video that I don't normally do. Okay, I'm actually on side 2 now. The second 15 minutes that I have to lay on this side to coat the bladder. And I am most definitely feeling an allergic response in my body. Right away, I just felt weird. I think I explained that on the way home. You can feel like an immediate, your body knows what's going on, that it has a toxin or a infectious agent in it. And I got home, and pretty much right when I turned on the first side, it started to happen very slowly. And now I'm to itchy eyes. They're actually not watery at the moment. Bladder, not intense pain. Bladder discomfort and pain for sure. I feel it every once in a while. My throat is like I want to cough. It's like being in the depths of spring when the pollen is going, if anybody knows what that's like or has that. It's lucky enough to have that. That's definitely what it feels like right now. So lungs, swelling up, throat, scratchy, eyes, scratchy. Not so much in my sinuses, but I actually already had that. Bladder, discomfort. This is the third turn, and I really feel like poop. Just full-blown allergic reaction. This is the 10th time I've done this, and I felt pretty much the same every time, so I know what to expect. It has not changed. In fact, I believe it's gotten a little worse. At least it has right now, and that might have something to do with how busy I've been lately. So keep that in mind. It's not, when we think about symptoms and such, we gotta, be smart about what we're doing, not just jump to any conclusion. I just was on airplanes and running around and giving speeches and answering questions and meeting people for 3 days. You know how hard that kind of stuff can be on you, like when you get home from vacation and how you feel. So, that might intensify a little bit of it, but I do not regret all that stuff that I did, everybody. That was fine. I would do that after. It would be hard, but whatever. Yeah, so maybe gotten a little bit worse. I feel like it might be leveling off, but we'll see by the next turn. The fourth time, and I feel about the same. I think it's leveling off a little bit. So from here, it will go nothing but better. And really by the afternoon, I'll have minimal effect, right? But for many days after this, I will still have bladder discomfort, urgency to urinate sometimes, and that will wane off over about a week, right about in time for me to go get my next shot next week. So that's the thing about BCG therapy. So it went well, it went normal. I'm getting a reaction. So now it goes into going to the bathroom, flushing it with water all day, drinking a ton of water, flush, put it in the toilet, put bleach in the toilet to kill the toxin and flush. You only have to kill it for a while per my instructions, of course. Check with what your physician tells you about how to do that method. It's very important. And keep in mind that it's something that other people can come in contact with. Animals can come in contact with. Try to be careful with where it's left and how it's disposed of. And as far as intimacy is concerned, you have to be careful with that too, because that can be transferred via sexual activity. Keep in mind. And if you are sexually active, wear a condom. I'm overprotective when it comes to that type of thing. Do your own research, talk with your physician. But it's important that we do this smartly and safely. I will go on the record by saying the next couple days were pretty bad. the worst reaction that I've had in a year and a half on BCG. My lungs were constricted. I couldn't breathe very well. My nasal passages were swollen up, headache, kind of nauseous. I didn't vomit or anything like that. Nothing to go to the hospital about for me, but make sure if you need to, you go, because these could get worse depending on what your health is like or other factors, or I think I have a little bit of sickness otherwise as well. So it was the worst one I've had out of 10. Keep that in mind.